convinced me that that my English, wow, what I was doing has a value for the others, besides for my clients and for myself, or for the patients and for myself, that I didn't find any relevance what I was doing. So thank you, Sol. It was a few years ago when he wrote, I told him, you have to review my curriculum vitae. And he wrote a paragraph about myself, and I said, well, so, and after that, many more people has given the very good compliments for the work that we are doing. It's a team, so it's not myself. So the team, part of the team is here. So I really appreciate that. I'm a physiotherapist, okay? And then when I finished physiotherapy, I was, dear practitioner. No, I should not do it. You're sorry. When I finished physiotherapy, I wasn't, I wanted to study anthropology. I wanted to do something related to the mind. Then I thought, then I will study psychology. Then I was not really satisfied with what I was seeing in the system. It did not work for me as a patient when I was a teenager, so I was searching. And then I studied Rolfing, and since that, everything changed in my way of understanding the person and not the patient so much. So in the year I worked for 7 years as a physiotherapy in the harbor of Castellón. So that was very interesting for me. At that time, it was hard times in the area, so I work with a lot of tough people also, and then I studied Rolfing, and then I quit my place and work in a private practice as a Rolfer. And then in the year 98, I was invited. It was Benicassin had a tradition of having a kind of balneary rehabilitation center, very big. So people from all over Europe, they were coming here for rehabilitation, not only neurological, but also orthopedic problems. So there was a program with the Social Security from Sweden, and they were coming here. There was mostly rheumatic patients. I was there for a year. That was, I didn't mention, but it was my first job as a physiotherapist. So I kept that in my mind. So in the year 98, I was invited by a company that I'm still working for to run the part of the physiotherapy program. So I'm going to present you my evolution as working in this program, how has been along with my evolution as a person and as a practitioner. So when Sol told me that I have to name my program and not to work on only under the umbrella of the organization that I was working, it was hard for me to find a name. I was not satisfied with the name. My practice name, my clinic, I also have a clinic, so I'll explain later. So I was working for a name, and I ended up calling it 3H RIA, which means working with hands, head, and heart. And this has been so important for me, name it this way, because that's how I really want to work. This is what I really has changed my understanding of my own work. So I will present only the physiotherapy part that I'm allowed to present. I'm in charge of the physiotherapy program. All the patients that we work with, they are rheumatic patients, so they have different rheumatoid problems. But my program, when you see afterwards, you will see that it can be applied to almost everyone. So rheumatism or rheumatic disorders is a non-specific term for medical problems affecting the joints and connective tissue. When I studied Rolfing, they told me that I should not work on rheumatic patients, that I should not work deep. So I kept that in my mind when they told me to run the program. And I was even afraid to work with them in the way that I was working as a Rolfer. There are many rheumatisms they're very different. They have common symptoms, but it's very different how people feel about it. They have common symptoms that they're pain, rigidity in the morning, deformities, swelling. And so we have to deal really with the reality that they have. So I'll just mention some of them. We'll just, so you know how broad is the rheumatism, just to keep it in mind. So those are the characteristic symptoms that, and they're very difficult to treat because it's a chronic systematic disease. It's not something that you have it or not, and then it goes. You have it. And for me, what I have learned through all these 14 years working with them is that I'm very interested in the person. So I'm going to talk about this. How I have changed my way of when I start with the program to where I am now. So at the beginning, when we start with the program, the patients come for 1 month and they stay here for 1 month. So for me, it was a dream come true. So you have one group of patients where you can work for a month and you can do anything that I could do anything that I wanted for movement and manual therapy. So what I did, I was already a rolfer. What I did was to search about the programs that they were doing in other places. And mostly what I did is copy what they were doing. Okay? So soon I was not satisfied. The first year I was already, you know, we were doing movement, we were doing massage, we were doing hydrotherapy, but there was something in me that I was not satisfied. I was not working like this in my clinic as a rolfer. So my work was divided. I was working with the groups, like 5-6 months a year, and then I was running my clinic. So there was something in the program that I was not satisfied. And it took me years to discover, because it's been an evolution. What happened at the beginning is that my patients, they came and they were just receiving. They were receiving treatment, they were receiving information, they were doing exercise, and I was a physiotherapy and I was doing a physical intervention. So that was where I learned to work with these patients. And I was not satisfied. So I had to change. How to change it? Being in the system. How to change it to get paid and have results. So that was a lot of pressure for me because I could not change everything. And it's we have to do before and after assessments and evaluations. So how could I do something that I was satisfied in the way that I thought that it was really more like a holistic approach? I thought that the patients have to have a role as patients, as human beings, and I have to have also my role. So how to get then implication in their own process? That was really very, very important. That was a big change. They were not only receiving, they have to get, so how much could I engage them? Too low, it's because it's a chronic disease, soon they will not be doing anything. And it disperses and disappears. So when they go back home, it's like, you know, they've been here, they have received the treatments, good climate, good food, holiday, but nothing really impacts them. So too much information, too much. It's for some people, it was even difficult because, you know, they thought, oh, I have to change my whole life. So we know as practitioners that this is an art. How much can we engage our clients and our patients? We're not the ones that they're changing them. We have to be an inspiration. So that was my goal. I have to be an inspiration. My team has to be an inspiration. So how to discover even with your limitations, that you can be healthy, how to discover that we can work on prevention, how to discover. So any of the things that we do as practitioners, as structural integrator, role first, massage therapy, can be really applied about what do they need. For me, it's very clear the difference when we consider symptoms, when we consider really working with the person. So in rheumatism, we have to go back and forth from symptoms, treating the symptoms, and working with understanding on prevention, understanding what is still the potential of this person. Because what I've seen is that it works much better when they are not in an acute phase of the illness. And this is one of the things that they do differently when they work in hospitals and so on. They work more when they have acute symptoms. And that's such a mistake in rheumatism. The best potential we can get is when they are not in an acute symptoms. We really become a team. I really tell them, I'm not working on them. We becoming a team. So this is sometimes difficult because many of them, they're not ready for that. They just say, do it, okay, either a massage or I do it, the exercise, but they don't want to get this collaboration. So this is something that we as a team have to encourage. And it's very important that the whole team understand this concept. Otherwise, they soon feel that something is missing within the team. So the whole team has to understand the holistic approach. So really the change of the whole thing, for me and for them, was awareness. It has been so important that we as practitioners understand what awareness means. And all the programs, if I will just show you some pictures with the program and so on. So if you go through all the rheumatoid programs that they do in hospitals or in centers, from the outside, they could look the same, okay? So they do exercise, they do pull, they do massage. But how do we deliver the information? How we as practitioners are different. It's very different, and the key point is awareness, okay? I want them to live in their bodies. This is something that is missing so much, many times in rheumatism. They only live when they have pain. And when they are fine, they're not really enjoying their bodies. So to live in their bodies, it was what I wanted for them. Come back to your body. Come back to your proprioception. Come back to feel that you are alive, besides that you are an ill person. How can we do it in a way that we work like this and we are still in the system? So that was, again, my question. How can I be in the system, but from this holistic approach? So always come back to my mind the word awareness. Always. Live in your body, awareness. Feel yourself. And from there on, everything changed. You said that we are trees. So that's how I see the work that we're doing. It's a tree that is growing and has branches and more branches, because we are including more and more professionals, because we want to give the rheumatic the possibility that they are able to choose what kind of movement they need, what kind of manual therapy they need, what kind of enjoyment. So it has been a learning process for myself to create the whole team collaboration and to be in the system. Sometimes it's not easy because we have to measure. We have to do before and afters, so we have to measure. So we are a little bit under pressure sometimes. But I have worked with 2,000 patients in the last 14 years, and it's about 90-something% with objective measurements that they have improved. And most of them, they decrease the intake of medication. They have a longer time when they go back, that they can work full time. They have, of course, less pain. They sleep better. They move better. And they tell us always one thing: I enjoy much better. Yeah. So it is very touching for me, because I see it every day. One important thing, starting from the base, is that I didn't want my patients to be in a place look like a hospital. So we're doing the programs in Hotel Azor, where you stay in. Okay? So we use all the facilities that you have used as normal people for them. And I think that that's also a very important thing. When you are ill and you are in an ill atmosphere, I think that you become more ill. I feel privileged to live here because we have the sea and the mountains. Castellón is the second province of Spain with more mountains and more rural parts. When they come, I do an assessment and I go with the medical doctor and I check them, all of them. And we divide them usually, because we get a maximum number of 30 people, so we divide them in 4 groups, depending on the stage of the illness, limitations, pain, age, and so on. And we usually divide them in 4 groups. And we do individual and group work. Okay? So not everything is done individually, not everything is done in groups. The reports before and after, done with photographs, it's very amazing how it changed. So numbers are one thing, but the reports with photographs, they really touch them. It's very important. So we have started doing it more and more often, do it before and afters. Okay? I don't do a structural integration as the 10 series. Okay? I do individual sessions, but it's a combination of massage, myofascial release, mobilization, cranial, matrix rhythm therapy. Every day from 8:30 till 2, I try to do the treatments in the morning, so they have time for eating and rest. And then we do more the educational and kind of having fun activities more in the afternoon. So they are divided in 4 stations and 4 groups. One is massage, as I told you, manual therapy, electrotherapy if needed. The working in the water is just fantastic to work with them. I think that this is one of the most important things that I can contribute to them. It's because they have many limitations outside, so the water is a key point for the program. I think that without the water, it will be very difficult to really function and to run really the program. Also, we do exercise, movement in general, in the water, more aerobic. We teach them how to mobilize each other. So part of the educational part is not about receiving, it's about how they touch, how they move other person. And this is also, they like it very much. So they participate and they exchange. Even if sometimes it's difficult for them, because they tell us that they're not used to touch each other at all, but at the end they like it very much. And it's very efficient, because they understand much more about their bodies when they become a bit therapist. We even teach them to do mini sessions to each other, to have a feeling of what is floating, what is relaxation. Because they tell me, when I go home, nobody will do this to me. So no excuses. You're gonna learn something, so they take it now home. Then we do ergotherapy and kinesiotherapy. I don't pay too much attention to riding bikes and gym exercise, because they can do it at home. And most of them, they come with the fixed idea that they come here to run a marathon or to learn how to be a bodybuilder by the end of the month. So, but most of the things, they can do it at home. We pay a lot of attention to the hands. Most of them, they're very affected, the hands. So you should really pay a big role in our program. So we bring ergotherapists to work with the hands, but also we talk about what are the hands, what do they mean in the context. Your hands are your expression. So how, when you have a deformity in your hand, how that is related to the way you move. So if you have a deformity in your hand, sooner or later you're gonna have a problem in the shoulder, and sooner or later you will be limping because of the not having contralateral balance, and sooner or later you will have a stiff back. So many of the things that the rheumatoid patients have, the medical system tells me that is because of the rheumatism. My observations is that many of them come because of the compensations that they have had through the years. So that's where we have a big role still to discover and to work in the compensation and in the prevention. Most of the patients get very much emotional or psychologically affected by their illness. When you lose the capacity to move, to express through your hands, and difficulties for walking, life becomes very hard. The feet, even if they don't have problems, we teach them exercise, so they get more connected into the way that they walk. Many of them, they're taking very hard medications, tremendous, very hard, besides the cortisons. Okay, so the tissues are very much affected. So this is really an art to work with them. What kind of touch can I bring to them? What kind of touch? So this kind of dialogue, this kind of communication, it's very, very important. Besides doing the group exercise in terms of movement, the individual exercise, and we apply tonic function, we apply, because it's very important for them. They lose proprioception easily. They've been affected on the most of them, they have affection on the feet, deformities. So to recuperate the body schema, it's so important, because some of them, they do exercise, but that pre-movement is lost. So we work more and more with tonic function. I try to give them tools that they can use at home. I tell them, you have to have your own gym at home. Physio ball, little balls, TheraBand, small rings to work with the hands, whatever that is not expensive, and you're gonna use it. Because, you know, more and more there's more expensive equipment, so people think, oh, we're using this expensive equipment, so when I go home, I will not be able to use it, so I don't pay attention. So in this hotel, this is one of the most expensive gyms in the area. We don't come here. We could, but we don't use it. So we're using much more different ball size, different awareness, proprioception things, because this is the reality that I want them to have when they go home. We also work with children. Okay. Once a year, we have a group of children. They come in next Sunday. We have a group of 40 children. And working with the children is really, really a very different experience, because we're working with the children and with the parents. So we do the same. We do for the stations, but we bring the parents in each of the stations, not every day, but we invite them to come to see how we work for massage. We invite them to see how we do the water. We teach the parents to do the water, okay? I think that when it comes to talk about a chronic disease, especially with children, parents have to learn. Parents have to do. You cannot take your child every day to a physiotherapist or to the hospital just for doing the treatment, because it becomes so expensive, so tiring. So I think that when we're working with the parents, you see really a progression when they get more involved. So we do the same. We teach the children how to massage each other, but they love it. They're very sensitive. But this program, I found that it could be applied for any people with chronic disease, but for anyone who wants to really understand more about their bodies. And so if you have group of people, if you have group of patients, we will be very happy to host you a program here that you can direct your own program and we can support you. I would like to show you a video that we have done, and you will see really how we work. And it's a video not done only with the hands and with the head, but it's really done with the heart. So it is a tribute to my personal and to my patients.
El nombre de nuestro programa es 3H's Real. Las 3H's quieren decir en inglés with hands, head and heart, trabajando con manos, cabeza y corazón. Esto nos implica trabajar de una forma holística, integral y sacar el máximo potencial de nuestros pacientes. Nuestro programa lo llevamos a cabo desde el año 98. La empresa sueca Hagareab Travel Point nos ha dado la oportunidad de trabajar con ellos y crear un programa multidisciplinar, en el que involucramos diferentes profesionales de la salud y los pacientes no están aquí solamente para unas vacaciones, sino están aquí de forma residencial para entender sobre su enfermedad, la relación cuerpo-mente, aprender de sus síntomas, aprender herramientas para que se las puedan llevar a casa y trabajar de forma preventiva y sobre todo para disfrutar. Una de las palabras que nuestros pacientes nos repiten continuamente es la frustración que sienten por su enfermedad. Creo que el reumatismo es una enfermedad difícil de entender para los profesionales de la salud y difícil de entender para los mismos pacientes. Dentro de los reumatismos, todos los posibles reumatismos, debemos adaptar nuestro toque a los tejidos que nos presenta el paciente. Los tejidos se ven afectados de diferente manera y con lo cual yo como terapeuta tengo que adaptar mi toque. Es un diálogo con el paciente, no es una manipulación simplemente. Mi formación en el método Rolfing me ha llevado a que pueda entender las compensaciones que está haciendo el paciente y a que pueda trabajar de una forma más global y no solamente entendiendo la sintomatología local. En el caso de OSA hemos trabajado liberando tensiones en todo el compartimento visceral para después ir trabajando en el cuello. Desde que hemos empezado a trabajar de esta forma, ella ha empezado a mejorar de su cuello y esto pues le ha dado mucha alegría y mucha motivación. Utilizo la terapia rítmica matriz del método del Dr. Ulrich Randall como un complemento muy importante para los pacientes reumáticos. Debido a la calidad de sus tejidos, el poder profundizar manualmente a veces resulta incómodo e incluso obtenemos pocos resultados. El aplicar esta terapia me ha supuesto un avance muy importante en nuestra forma de trabajar y en los resultados.
The right treatment and with the sort I've got here, it's making my life much better and my body feels better and my heart and my head. And I think also it gives me a more enjoyable life.
No tengo ninguna duda de que la prevención llevada a cabo con disfrute es la mejor medicina, incluso para los pacientes reumáticos.
This is the treatment I've been looking for so long, and I found it here in Badenes. And I'm so happy because in 1 month I have had my life back.
Last year I had spinal stenosis, and when I came to Benicassim I could not walk. But after 2 or 3 weeks here, when Bibiana had walked with me, I can walk a little, and after that more and more.
I have been shown a lot of good methods how to deal with all these problems. And now I sleep well, my fingers are very good, my back pain, who I have had for several years, is all gone, and I feel wonderful.
I have not so much pain, and I feel much better, and I'm very, very happy for this. I cannot have this treatment in Sweden, but I must say thank you to you, Bibiana.